My task is to talk for half an hour or so and then opening for questions on this huge subject. I will do my best to cover most of it. But I start with some semantics here because we're talking about AMR as a topic. And what is that? So AMR is antimicrobial resistance. Resistance can develop for any microbe, viruses like HIV, parasites like malaria. But the primary target for the world's work now, and what we have been doing in REACT for many years, is antibiotic resistance, bacterial resistance. That is also where the UN places this, and WHO places most of the efforts now. So I try to cover these points during my presentation. Some basics about the nature of the problem, the consequences for health and beyond health, for sustainable development. Is it really something that could be called a non-renewable resource? What are we facing? A world without antibiotics? How have we tried to bridge, and with me I mean everyone, the world, bridge science to policy here, to move towards behavioral change for everyone? And lastly, something about hopes for political will, collaboration and sustainable funding for this enormous crisis. Now going back to the Second World War, when penicillin came along and the discovery of Alexander Fleming was made a drug called the miracle drug. That was a starting point for something extraordinary. The whole health in the world changed. And when penicillin became available to the public, you can see this from this slide, the enormous power of penicillin, changing mortality in children with pneumonia and bacteria in the blood from 90% to 10%, more or less overnight. Magic. And then we have been used to get antibiotics for everything. These are bacterial diseases. Unfortunately, we are using it for virus diseases where there is no effect. That's one of the problems. But we have been used to be able to treat what we can see in society and in healthcare, these infections and more. Moreover, health systems in the world are building on effective antibiotics. Basic healthcare, maternal and child health. These small children that are prematurely born are really vulnerable. Also complicated the deliveries, and not the least modern medicine, transplants, cancer treatment, where you are reducing the host defenses, where you are vulnerable to infections. You need the protection from antibiotics. All this is at stake now, and it's a frightening scenario. So, bacteria is all around us. There are many. We carry them in our flora, the commensal flora, which we now are coming to talk about the microbiome. Can we defeat them? Can we fight them? Can we win? No. The war metaphor is ridiculous. I mean, you need to be working with antibiotics, with bacteria like friends. We need them. They are extremely important for our health and for the health of the planet. So we just have to find another way to deal with this problem. Resistance is a natural event. When antibiotics are threatening bacteria, some bacteria already have mechanisms for avoiding the effect of the antibiotics. And these are the different mechanisms where they can protect themselves, either by preventing entry to the bacteria, spitting it out, or making them not available to the target. So it's really a very easy problem, in a way, to explain, because there are two different drivers. Selection. The millions and millions of tons of antibiotics that have polluted the world, selecting these bacteria that are occurring naturally. then they spread. And this is happening because of our behavior as human beings, but also because of the behavior of the bacteria. Human behavior, just take this slide. These are, if you pile up all unnecessary prescriptions for antibiotics in the UK, they will come up this high. I've counted myself, it really fits. It's huge. It's a huge misuse, a huge unnecessary use of antibiotics. This is in the United States. You can get a 75% reduction in the price of antibiotics from a supermarket pharmacy. You can get this coupon from your doctor. Then these scary pictures, there are many, many. I can show you millions of pictures from the developing countries where the antibiotic use is completely uncontrolled. If this guy would have been alive, he would just have shaken his head, say, this is natural, it's a natural phenomenon, okay? We have bacteria in the environment, in our bodies, in our microbiome, we use antibiotics, they select, they have a competitive advantage, and this is what's happening. Look here, what is happening when you travel? These are French travelers, but we also have studies from Swedish travelers abroad. Healthy tourists going abroad for vacation. What do they take back in their fecal flora? Well, multi-resistant bacteria at the scale. They do not any harm unless they move to the blood, move to the urinary tract, give you an infection. And probably if you stay away from antibiotics, they will fade out over time. But in the long run, we are building up a resistant microbiome. And this is what is happening dynamically and quickly today. And the spread, obviously this is an ecological problem. It's everywhere. It's in human medicine, it's in veterinary medicine, in livestock production, aquaculture, environment. It's all connected. Antibiotics is there, resistance is there, and spread is there. So this is just one picture to show what is in our near environment here in Europe. This shows the figures of the magnitude of occurrence of the most resistant bacteria, resistant to one of the last resort classes of antibiotics. You can see that some countries has major problems. It's an endemic epidemic spread. We are still yellow in Sweden. But this is, of course, something that also will come, and we see the trends also in Sweden go in the wrong direction. If you have such a patient giving from those kinds of bacteria given pneumonia, like this case from Italy, this is on the right-hand side is the report from the lab. Most of the antibiotics are resistant. There are only 2 that might work. They are not good. They have side effects, and we don't know exactly how to use them or dose them. So we are sort of slowly approaching what we can call a post-antibiotic era. And this is the slow tsunami that will eventually make this whole health pyramid fall down. So why has this happening? I will come to that at the end. But for sure, antibiotic resistance has been below the radar. Not like other diseases like Ebola, the avian flu, swine flu. We now have figures that we can, I think, rely on. There are certainly probably underestimates of the burden in terms of mortality here. At least 500,000 a year people are dying because the antibiotics given is not working. I'm not saying that Ebola is not a crisis, but surely the world has reacted much more to this rapid crisis and more visible threats. We have not been able to visualize antibiotic resistance in that way. But during all these years, things are happening, even in rich countries, even in high technology settings, like in this CDC, NIH-driven hospital some years ago, where 6 patients died from these kinds of multi-resistant bacteria, and they have to do a lot of stuff to get these bugs away from the hospital, as you can see. Ripping out plumbing and rebuilding the ward. But the burden of this problem is falling disproportionately on the developing countries. And that has not been known or well understood until the last, let's say, 5-6 years or so. People have been seeing this as a problem in rich countries, but it's not. So these are just a few examples of what is happening in the developing countries. Children are dying because there is no available antibiotics. Moreover, in the middle here, you can see that there is lack of access. There is complete lack of access. Many, many children in Africa, in India, Southeast Asia, Latin America doesn't get an antibiotic at all because there is no access, there's no availability. The health system is not working. And you can see the mortality from these multi-resistant infections in an African country like Tanzania. There are many more examples. That's a huge crisis because it's also telling us that we have not been able to distribute antibiotics equitably. And we have to do that because that's part of the solution. We need to address the problem where it arises. So, sustainability. Fortunately, in the preparatory documents for the SDGs, one sentence was built in and mentioning antimicrobial resistance. So we are in there somehow. It's not like sharp indicators yet, but the fact that antimicrobial resistance was mentioned in that setting, in that context, paved the way, I think, that for the issue to become part of the UN system and also raised, as I will mention later, in the UN General Assembly last September. These are the 17 goals, and at least these goals can have a clear relation to antibiotic resistance. Meaning that if the issue of antibiotic resistance is not addressed, there will be difficulties to fulfill the SDG targets, like poverty. In many countries there is out-of-pocket expenses. Even in the developing countries, you have to pay for your health service, you have to pay for your drug if you should have an infection with a multi-resistant infection by bacteria. The cost will be enormous and maybe even up to the level of a year's salary, there are studies showing. This impacts on poverty alleviation for sure. The food issue is critical because there is a tension here between food safety. We don't want meat to contain resistant bacteria. And food security, we need more protein, we need more food. There is a demand. Those issues are conflicting, they're incompatible. And this is, the projection is that if we use as much as antibiotics as we do, I didn't say that we have rough figures in the world, at least in the US 80% or more is in the animal sector. In Sweden is 15, so it's different. But surely all over the place I think that antibiotics are used in volume more in the animal sector than in the human sector. And it will increase, but if we continue the way we do today, in a non-sustainable way we do today, it will increase by 2/3 until 2030. There need to be strategies to overcome this conflict and to secure livestock production without the unnecessary use of antibiotics, for sure. Sanitation is one of the other issues that is really critical here. Antibiotics are polluting, resistance is there. Even low antibiotic concentrations could select for resistant bacteria in the environment. And if you look upon the world and the 2.4 billion people in the world that lacks toilets, and the 1.8 billion that are using drinking waters contaminated with feces, and combine that fact with the following. These are resistant bacteria in the fecal flora in different WHO regions. And you can see the upper curve is Southeast Asia, where 60 to 70% of the people are having resistant bacteria in the fecal flora. If you go back to this, you can see what's happening. I mean, this is a frightening dynamic of spread through water and in the environment. Okay, we can go on, because it's also very costly. This issue is not only a health issue. It must be looked upon in a much broader context, and it definitely is something to have something to do with the economy of countries and even the gross national product. The World Bank recently released a report with figures on the magnitude of the cost of non-action. What would happen if we are not acting on this huge problem? And the global figures are scaring. There will be a blow to the world in par with the financial crisis, that report says. Okay, another goal is and consumption and production, responsible consumption and production. This is the core of the core of the problem. This is how the antibiotic use looks like in the EU. Greece in the top, Netherlands at the bottom, Sweden down there. For sure, the people in France and Greece and Italy are not more ill or less healthy than many others. So there is, of course, inappropriate use here. On the global scale, antibiotic use has been booming. It will increase. Countries are developing, the middle class is increasing, the demand is increasing. These are also scary figures, it's going up. So we will have to face a huge increase of antibiotic use, while simultaneously there is a bottleneck in the antibiotic production. That is really scary. And why is that? Well, we can speculate, and we don't have time to go into the details, but the fact is that the last antibiotic class was discovered in 1987. 1987. That's a long time ago. This is the cell wall of a gram-negative bacterium. Nice colors, a lot of complex structures, lipids, proteins. This is the real barrier. It's a scientific challenge which is enormous. It's a nightmare for medical chemists to make a molecule or to find a molecule that could pass through all these layers. So when people are talking, it's well, antibiotics, it's because the lack of the standstill in the pipeline is because there is less financial revenues and the market should be low and so forth. For sure, that's also part of the problem, but this is really the major bottleneck. There are a number of collaborations ongoing now, coming up. I don't think I have time to go through this in detail, but they're both in the EU, a project called Innovative Medicines Initiative, where people are really trying to focus on science and development in a new way with public-private partnerships. And there was also a quite large construction in the US. That's good. But look at this. If we need badly new antibiotics, that's for sure. We need them now or yesterday. If we get them, we are pouring them in a bucket with a lot of holes. So we can't just go for innovation, can't just go for new drugs. We also must fix the system. So we need to move away from sales, volume sales as return on investment, marketing, misaligned financial incentives, irrational use, prevention, water, sanitation, vaccines, everything needs to be fixed to minimize the need for antibiotics and to use those precious new, eventually coming drugs in a much more wiser way. And this is the challenge. We should have fixed this long time ago in the rich countries. We are not doing our homework. But what about the developing countries? How would they ever deal with that unless there is a strong funding mechanism to support the transition to a sustainable system that everyone needs to have? And that funding mechanism is not there yet. So what we have is supply, which is too low, and the demand, which is too high. And the demand needs to be high. We need to increase the access to affordable drugs in the developing countries, but we also need to minimize the irrational use. And that balance between access and excess is difficult. It's really, really difficult. So in our advocacy in REACT, we are thinking of a new model where we have innovation, but that should be needs-driven, not market-driven. It should be working perhaps with the pharmaceutical industry in collaboration to get it done, but then make a cut, which is called the linkage, so that when we have this drug, pay the pharmaceutical company, pay for the research, but then put this new drug in the hands of the public sector to be distributed and accessed to those in need. And this is not utopia. It's in fact something that is discussed on high levels now also with the pharmaceutical industry involved. So I think there is good hope that we can move to something more sustainable here. It will take time though. So a little bit of what has happened in the world and then some last words at the end. You mentioned Strama from the beginning, Peter. Yeah, that was a success. It started in 1995. It's still very much active. And the thing was that we thought in Sweden we had some problems, minimal problems compared to many other countries, but we still had problems, and we need to do something. And this issue is difficult because it needs to involve ministries, agencies, groups, is cross-cutting, and Sweden is quite good at collaborating, I think. So we've quite easily put together a national group. It has emerged. It doesn't look like this now because the agencies that is in the national construction are many more now. I think it's 20 plus agencies that are working together. And then the Public Health Agency is now hosting this, but I think the unique thing with this is this project is the local groups, the local Strama groups. In every county in Sweden there are groups functioning, funded and mandated to deal with this issue. And there are a lot of competence in those groups. One thing is of course to be champions at the local level, visiting health centers, visiting hospital wards, and trying to change prescribing behaviors through trust, reliable data, and credibility. Benchmarking is extremely important and effective. Showing what the other guys do is good, because you don't want to be the bad guy. So you will improve your practice. This is, and data for action are needed. So just quick summary of how we are moving. We're still moving downwards. I mean, these are the antibiotic use in different age groups in Sweden. You can see that the children, the small children, I mean, it's a quite amazing reduction in antibiotic use, and with no visible, measurable side effects, no complications. We're also measuring those, of course. We cannot see any side effects or drawbacks or negative side effects of this. These are children with cough and colds that previously got antibiotics completely unnecessary. And also in the other age groups, it's getting down. So we were pioneering in a way, and then the EU was following, and the WHO was coming to its feet. I think we put some pressure on our region and also on the world with this example. EU has been doing a lot of good things. There have been resolutions. There is a global an EU action plan. The ECDC, placed here in Stockholm, is doing a lot of important things. The problem with the EU is that health is a national responsibility. So the EU cannot legislate, cannot push pressure on the countries, just advising. Okay. We have a problem with the WHO. We had a problem because there was a strategy in 2001 which was not implemented, not funded, nothing really happened. It took until 2015 until the Global Action Plan was adopted at the World Health Assembly, and that was a huge step forward. Now there is a call to all countries in the world to have a national action plan. And this is moving, not in the pace it should, but it's still a good thing happening. Meanwhile, a lot of groups, projects, ideas are floating around. So the world has started to wake up. And specifically the G20 has been active and will be active also in the upcoming G20 in Germany. So, and next week there will be another meeting at the World Economic Forum on antibiotic resistance. But the real leadership, the real commitment and the difficult decisions ahead towards sustainability is not there yet. But the fact that the UN General Assembly took this up is of course a great thing. It was building on a lot of dialogue, a lot of interactions between ministers and countries and the UN, missions, so forth. So the issue was sort of floating around in the whole context of governments, which is good. And many of the heads of state were reading out statements, of course, written by someone else, but anyway, they were stating that this is something that they prioritize. What was not in this, so there's a lot of good wording here. What was not there yet is proposals for a transparent monitoring and accountability for access and use, targets that could be set, either structural process targets or real hard targets. At least we can do that in the rich countries, I would say. We have set a target in Sweden with 250 prescriptions per 1,000 inhabitants per year, and we're moving down to that. That could also happen in other countries. Proposals for governance, structures and accountability on the UN level, and not the least, could we at the end come with a specific sort of, well, of course financing, but also binding legal agreements. The most important thing with the UN political declaration was that a high level or an interagency coordination group should be formed. This has not happened yet, and it's soon 4 months since this happened, which is a little bit of a worrying sign. But we hope that that interagency group will be dealing with all this complexity and all these huge problems ahead. So, how did we end up here? I think these three issues are the most important ones. The failure to acknowledge this as an ecological, environmental problem and an evolutionary problem. And the fact that the whole world, and still, well, I would say in some places, are living in a self-deception that, yes, the industry will fix it again, we will have a new drug. This is not going to happen very soon. It's not going to happen. Will it happen? We don't know. We really don't know if we can get new antibiotics. So the market-driven innovation models has not yielded what we need, and we need to change that. The frightening truth is that we're running out of the old technology, but we have not yet, at least, any available alternative technologies. I mean, the comparison with climate change is there. There's a lot of similarities. It's a global public good, it's long term, it's everywhere. But one thing that is maybe differentiating antibiotic resistance from the climate problem is that we don't have any alternatives yet. And that's a scary thing. I think much more focus needs to be put there. We're talking about microbiome engineering, nanotechnology, things that might eventually, in the long term, replace antibiotics. But for the next 10, 20, or even 30 years, I'm quite sure that we need to have the old technology back and use it in a much more, in a much better way. So I will end with this. It's a quote from your excellent Nature paper. I think this is exactly where the world needs to head. Everyone needs to be involved. All agencies, all areas need to be involved. This is truly something that is cross-cutting. It's not a medical problem. It's not the problem for the health ministers. It's a problem for the whole of government, for the whole UN system, not only the WHO and FAO, but all other agencies need to be involved. This is so big and need to have a much bigger impact on policies. So we have been doing quite well the last 5 years. I mean, the world, is reacting. The awareness is there. National coordination is there. Rich countries have their plans. Surveillance is coming up. Targets are set in some countries. Funding is fragile, but it's still sort of talked about. But to get to the last 3 points is difficult. And again, I must reinforce that we need to find a way to support the transition of health systems in the developing countries. Without that, we will fail. So there needs to be something supporting those countries. I will stop there because of time, so thank you for listening.